Good afternoon, everyone. Thank you for joining me. I'm Judy. I'm the CEO of ABC Medical. Many of you I have had the opportunity to meet, and hopefully, if I haven't, we can hopefully meet in the near future. So, thank you for taking the time to join me today, and thank you for all that you do to make ABC Medical a great place to come for our patients' healthcare needs. So, what I'd like to talk about today is the direction that ABC Medical is going. And the direction that we need to go in is we need to really focus on technology. Technology has come a long way, and with this change in technology, we have an opportunity available that we can really enhance the care that we're giving and also our patients' overall experience with that. So, as a lot of you know, we have been discussing and working on implementing a new HR system. This will make a really big step in the overall performance of ABC Medical and the care that we're able to provide. So, I'd like to talk about technology today in this direction and keeping in line with our vision and our mission of people and our patients and how we can improve that. So with a new HR system, this is going to help improve the overall experience for our patients and our care for them, giving better outcomes, also the safety that our patients have, and for our people, our associates that work here, the care that they're giving. And we're going to be able to streamline this process using a new HR system and the new technology that we do have in place. We're going to be able to give the very best care. Starting with that, just some examples I'd like to give you. Registration process is going to be so much easier for our patients. The example of a patient in the ER. That patient can be triaged and immediately taken back to take care of their health care. And at that point, one of our associates can come in with a computer on wheels and take care of that registration process in the patient room as our employees and our associates are taking care of that patient and their healthcare needs at that time. Same with our outpatient process. That will be much more efficient, having the patient come in. Oftentimes the orders are already be faxed over by the primary care physician for specialty outpatient services, EKGs, x-rays, labs, whatever. They sit down with registration, get all of that information in. So then in our system, whether it's inpatient or outpatient, we'll have all that demographic information stored in our computer system. That will be easily accessible for any other visits that the patient may have, or their insurance information will be in there, any allergies that they may have, their fall risk at that time, even though they do have to be screened every time that they do come in. We can also implement that as a direct admit onto the floors. We can get that patient in, a direct admit from their primary care, and get them registered through registration right in their room as we, again, are taking care of them and getting their IV started and drawing labs or getting that process started. So it's going to help with our employees with their charting processes. Charting is a big part of our job and a very important part of our job. So looking at different systems, that was our discussion. How can we make this more efficient and easier on our associates? And definitely with an EHR system, that is definitely going to help. No more looking for lost charts. Where are the charts? Where's the MAR to chart in? Associates have complained they do spend a lot of time looking for those charts. So now in each room will be computers. You'll have availability to chart in the patient room. On the system, we'll have a flow sheet. And those are pretty simplistic. You're just plugging in your numbers, and it's going to make your charting much more efficient. Physicians will have order entries. So they'll be entering their own orders into the computer. You'll be able to pull those up, not again looking for the chart, and also deciphering what the orders are, calling the physician if there's any questions on the orders. That will be entered by them and easily accessible for any associates that we have. All their allergies again will be listed on there. Their DNR status would be listed on there. All of that easily accessible in the patient room. That's going to help enhance our patient's experience. If we're in there charting with our patients are able to ask questions. We'll have access to pull up any labs that may have drawn, any tests that they may have done. Testing is a lot of what we do, and that's always a lot of questions of our patients is, how did my test turn out? How did my test turn out? What did they say? The nurses will have access to that to pull that up. Also the physicians, when they're rounding with their patients, and would have that accessibility too. So it's going to be much easier for charting. It's going to streamline that charting process. And then there's the safety factor. With our records all on the computer, it's going to help with flagging the any type of drug interaction. So our MAR being on the computer is just going to help with that. Flag if doses are too high. It'll give the opportunity to be able to scan the medication. So the patient is scanned, the medication is scanned, and that is really going to help with overall outcomes in our patient safety scores. Having that process in place is going to be just really make a big difference with that. So that's the inpatient side and how that is really going to help with our processes and the functionality of that we can do. We also want to focus on our patients and what type of technology can help improve their experience, because there's a lot of changes too that will definitely help our patients, their overall experience. We want to empower them. We want them to be included and be a part of their healthcare. Things have definitely changed, and patients want to be a part of their healthcare. And technology offers that. With Patient Portal, that's a way that our patients have access to their own medical records, their own tests. It does offer that they are able to get alerts when their medication needs to be refilled. It will help them with their overall health care, accessing through that. Education is a big part, whether they're inpatient or outpatient. Inpatients will have information on tablets for education, and outpatient basis, patients can have that also through the patient portal. Whether they want to quit smoking, whether they have a new diagnosis of COPD, whether they are newly diagnosed with diabetes, they have access to that information on their disease to help them feel more empowered. Also, telehealth is another way of technology helping our patients. A challenge of our patients in the rural areas are definitely getting to the physician, and the cost and the time sometimes to do that. So with telehealth systems in place, there's an opportunity where we can really improve and really help our patients by being monitored and having that information come over to their primary care, whether it's, watching for some trending of for their diabetes or their blood pressure, or maybe their oxygen level, that they're with chronic diseases, that their healthcare provider will have access to that to make those necessary changes. Also with technology with our patients, social media is a great source of support for them. Online communities, Twitter, Facebook, where they can connect with other people that are facing the same kind of challenges or diseases that they might be. Connecting with them really offers that opportunity for the support for our patients that need. So, improving our care, and again, our patients' overall experience is the focus that we want to be in line with our mission and our vision, as I mentioned at the beginning of this video. So technology, again, is really going to help enhance that. So thank you all for joining me today. And I hope that answers some questions and gives you a little bit of overview of how we're going to move forward. And you all have a great afternoon.